Now that we know a little bit more about psychological disorders, I want to say a few things about psychological treatment. There's generally two major approaches to treating a psychological disorder. There's the biomedical approach, which are things like medications, and then there's a therapy approach, things like talk therapy. Biomedical therapies are good when the underlying cause of the disorder is biological, or if there's at least a large biological component. So for example, with depression, we know that depression is largely chemical imbalance in the brain. Things like serotonin or norepinephrine aren't working appropriately, and that's causing a person's mood to be altered. That means when a medication can help alter the levels of those neurotransmitters, serotonin or norepinephrine, that it can help improve symptoms. So the book describes medications for depression like SSRIs, selective serotonin reuptake inhibitors. These are efforts to try and change levels of serotonin. For anxiety disorders, there's things like Xanax, which is a mild sedative. For things like bipolar disorder, there's lithium, which is actually a salt meant to stabilize mood swings. For things like schizophrenia, there are antipsychotic drugs that are meant to help things like hallucinations. Now, keep in mind that all medication has some kind of a side effect, and this is true whether you're taking a medication for a psychological disorder or if you're taking a medication for anything in your life. There's always a list of potential side effects. And the reason for that is because when you're taking a medication, you're essentially putting synthetic chemicals, synthetic neurotransmitters or synthetic hormones into your body to compensate for some place in your body things aren't working appropriately. Unfortunately, we're not good enough yet to be able to tell those little molecules in that pill which exact parts in your brain or which exact parts in your body need help. So instead of just going to the one place where the levels of serotonin, for example, are inappropriate, it actually goes to your entire brain and messes with the serotonin levels everywhere when we're talking about an antidepressant. So there's always side effects because those chemicals are impacting your entire body and not just the one small place that actually needs the help. The picture here on the right is of ECT, electroconvulsive therapy, which is what a lot of times people think about as electroshock therapy. And this can be a treatment for severe depression. So it's a biomedical treatment that's tried often after medications have failed and after therapy has failed for people who are suffering from really severe depression. A lot of times people think about shock therapy as being barbaric, but the way that it's done today, it's actually not. And for people who have chronic severe depression that hasn't responded to any other treatment, this can actually be a really useful tool. Then, of course, there are psychological therapies, and these kinds of therapies are good when the underlying problem is psychological, which is very often the case. The book talks about a lot of different kinds of therapies, and that's because there's a lot of different camps about the kind of best therapy. So psychoanalysts, for example, want to look at your past and see how your childhood caused you to have the problems you're having today. Cognitive behavioral therapists would say that you're having inappropriate cognitive cycles, and that if you can change the way you're thinking, you'll change your emotion, etc., etc. This is important to note because the fact is that not all therapists or not all counselors are working from the same model. Some of them are psychoanalysts, some of them are cognitive behavioral therapists, some of them are humanistic, which means that they have different approaches. And so like buying a car, when you are trying to look for a counselor or a therapist, you might actually have to try to test drive a few because you need to find someone who meets your needs, who's compatible with you, who you trust, and who's going to allow you to do the psychological work that you need to do in a way that you feel comfortable with. So a lot of times people will have gone to a therapist once or a counselor once and had a really bad experience and never try going again, which I think is really tragic because therapy actually is quite helpful. It's just a matter of finding the right therapist. So don't feel bad if you have to go through a few to find the one that's right for you. A lot of times people want to know, does therapy work? And this is some data that came from numerous studies. So this is a meta-analysis where they take lots of different studies and collapse them across each other. And it's showing the outcomes for people who received therapy versus who didn't receive therapy. So the green bell curve are people who are not treated and have psychological disorders. The yellow bell curve are people who did receive psychotherapy, some kind of a psychological therapy, and have a psychological disorder. On the bottom, we can see outcomes from poor outcomes to good outcomes. Poor outcomes means they continued to suffer or got worse, and good outcomes mean that they got better. So you can see that for the people who did psychotherapy in the yellow, they actually had a better outcome on average, which is the blue line leading down from the center of the yellow curve, than those who didn't get any treatment, the people who have the blue line running down from the green curve. So a vast majority of people who go to therapy and find the right therapist say that it helps them and that they got relief from therapy. So you might be wondering which is better. Well, most research indicates that actually therapy and medication together are more helpful than either one is alone. And of course, this varies a little bit based on the specific disorder that you're talking about, because the specific kind of treatment for each disorder varies. But on average, taking a multifaceted approach is more useful. Additionally, I'd like to throw exercise into here. A lot of times people who aren't feeling well, especially when we're talking about mood disorders or anxiety disorders, find that a regular exercise regimen can actually help improve how they feel also.